am Ely, and you're on the tube with Ely. That's the name of my show, and my channel is all about information and just a little bit of entertainment. And we're gonna start out with talking about cancer, and that's because it's really a big thing with me nowadays, because I suffered from breast cancer the past couple of years. I'll tell you a little bit more about that later, but we're going to talk about what it is, what it's not, different treatments, natural treatments, and healthy living. And we'll be hopefully hearing some testimonies. You know, there are a few people who have chimed in that they want to tell you about what they have gone through with this dreaded disease, cancer. And I know that some of you have gone through it, are going through it. Some of your relatives have gone through it, and then some have not even made it through. So we're going to talk about all of that. So what we're going to start out talking about, what is cancer? Well, cancer is abnormal cell growth. We're born with cancer cells. They're a part of our bodies, but when they get out of control, when the patrol that, you know, goes out to keep them in check misses them, and they start to grow and multiply, then they turn into clusters. Those clusters then turn into what they call tumors. Not all tumors are malignant. You know, malignant is when the disease, well, when the tumor is offensive, you might say. When it's, it can be, frequently they're fatal, but not totally. There's always hope and a chance, okay? And then benign, of course, means that the tumor is basically harmless. Okay, so then what we do know is that cancer is not prejudice. It don't care how old you are. It don't care how young you are. Babies get cancer, you know. Old people get cancer. Middle-aged get cancer. Teenagers get cancer. I know you've heard of St. Jude Hospital. Well, St. Jude is specifically tailored for children with cancer. Okay. So now there's different types of cancer. And we're going to just read you a little information here on the different types of cancer. Okay, we have, first of all, we know that cancer can occur in any part of our body. And so there's 5 main categories of cancer, okay? So we have what they call carcinomas. Carcinomas. C-A-R-C-I-N-O-M-A-S. That's if you want to look that up. So carcinomas begin in the skin or the tissue that line the internal organs. That's like in the lungs or the kidneys or the bladder, you know, the breast and things like that. Then we have sarcomas, S-A-R-C-O-M-A-S. And sarcomas develop in the bone, the cartilage, the fat, the muscle, or other connective tissues. Then, of course, there's leukemia, and I know you've heard a lot about leukemia. Leukemia is a blood disease. It begins in the blood and the bone marrow, okay? And then there's lymphoma. Lymphoma starts in the immune system, okay? That's most times the lymph nodes are under the arm, and that's usually where they go in to take them out if they have to. Then we have cancer that starts in the central nervous system. That's in the brain and the spinal cord. Okay? So, now that you know about those 5 different types of cancer, the first cancer we're going to talk about is carcinoma. Carcinoma. And we're going to start with breast cancer. And we're going to, not only is it the #1 killer of women, but it can occur in men. Yes, you could look that up. Men do actually get breast cancer. So what causes cancer? Well, cancer is generally caused by infections, viruses, and parasites. 18% of all cancers are related to infections. 18%. And of course, the other 23% is related to obesity or lack of exercise. You know, just body is just lazy. You know, and so the infection fighter patrol is laying around doing nothing because the body isn't doing anything. Okay, so now the breasts are made up of glands called lobules, L-O-B-U-L-E-S, lobules. And these lobules can make milk. And the ducts that carry the milk from the lobule to the nipple are in the breast. Fat and connective tissue, lymph nodes, and blood vessels, all that makes up the breast. And so the most common type of breast cancer is called ductal carcinoma. Ductal carcinoma. And it begins in the cells of the ducts, okay? And remember I said the ducts can carry milk, you know. So it's classified as 2 different things. It can be in situ, I-N-S-I-T-U, in situ. And in situ is, excuse me, abnormal cells that's found in the lining of the ducts, but it hasn't spread outside of that duct. That's in situ. Then the other one is called invasive. Invasive is cancer that is spread from where it began in the ducts or the lobules to the surrounding areas, surrounding tissue, rather. Now, I was a victim of breast cancer, and I had the invasive kind, the kind that has spread outside of the duct area into the surrounding tissue. And I was told that it was 2 centimeters, you know, which meant that the tumor was small. I was happy about that, you know, but still, cancer can still be dangerous. I don't care how small it is. So let's walk through the process of how I even found out that I had cancer and then everything thereafter. Okay, first, I had an exam by my family doctor, and she felt a lump in my breast. Okay, and then, of course, she asked me, had I been feeling anything, and I'm like, no, I had no idea it was there, you know. So she sent me out for a mammogram. Now, a mammogram is the X-ray of the breast, and it's used in screening breast cancer. And mammograms, they can find tumors that are too small for you or your doctor to feel. Okay. Now, there's different types of mammograms. There's the standard mammogram, which puts the images of the breast on film. And I was told that this mammogram showed suspicious activity in my breast. So it was something that they said was shaped abnormal. And so then, because of that mammogram, she sent me out for what is called a digital mammogram, or let me see, it's digital, and there's another name for it that escapes me right at the moment. But anyway, the digital mammogram puts images of the breast into an electronic file, and then this allows the doctor to see different views of the breast without taking more images. And the images are measured in what they call BI-RADS, B-I-RADS, BI-RADS. And this BI-RADS stands for Breast Imaging Reporting and Data System. Okay, it was established by the American College of Radiology. Okay, I know it's a lot to get into, you know, but let's give you a little bit more information about BI-RADS, okay? Because this is what, you know, they measured my cancer according to this BI-RADS scale. So 0 is incomplete, 1 is negative, 2 benign findings, 3 probably benign, 4 suspicious abnormality, 5 highly suspicious of malignancy, and 6 known biopsy with proven malignancy. So mine was highly suspicious of malignancy, and so of course that meant that it was a 5. So, and I had been looking up information, you know, on the net, and so I knew that if it measured a 5, that it probably was benign, I mean malignant, you know. So I didn't get totally bent out of shape just yet, you know. So anyway, there's another kind of mammogram, what they call a 3D mammogram, which uses both the digital mammogram and the breast, what they call tomosynthesis. And I didn't have to have that one, you know, because I guess the digital one said enough. And so it was recommended at that point that I have a biopsy to determine whether, you know, further whether the tumor was malignant. Now, biopsy is a medical procedure that they use to take a sample of abnormal tissue in the body, and it can be, you know, anywhere that they feel these tumors, okay, and mine, like I say, happen to be in the breast. So then, well, I went and had the biopsy, and then the doctor recommended me to an oncologist because the biopsy came back positive for cancer. And so they recommended me to an oncologist, and the oncologist told me that you know, they could do a plan. And what happens with the plan is your medical practitioner, the oncologist, the chemotherapist, and the radiologist, they all sit down to work out this plan. And the reason why the radiologist was included is because I opted not to have a mastectomy. A mastectomy is when they remove your whole breast, okay? And because the tumor that I had was rather small, I figured, well, let me do this treatment first, you know. And so they sat down and they planned for me. First, I had to have the surgery, which removes the tumor, okay? And that surgery procedure is referred to as a lumpectomy, okay? A lumpectomy. Now, during the surgery, there's several things that go on during the surgery. One, they remove lymph nodes, like I said before, from underneath the arm. They go in and make an incision, and they remove these lymph nodes. Now, if the tumor is large, they remove a lot of them, you know, and to test. But because mine was small, they only removed 3 of the lymph nodes, and then they tested those, and they showed negative. So there was no cancer in these lymph nodes. So that gave them a better idea of what type of treatment, according to them, that I would need to take care and get rid of this cancer, well, to get rid of and take care of. So, while I was in the surgery, because they had recommended chemotherapy, which is, you know, when they flood your body with these chemicals, and I'll tell you a little bit about chemotherapy as we go along. They asked me if I wanted to have a portacath. Well, a portacath is when they put this tube inside of your chest cavity. Well, on this side, actually, it's the opposite side of the side that I had the breast cancer on. And they put this portacath in there. And what happens is the nurses can go directly in this portacath, stick a needle in there, and administer the IV, carrying the chemicals or the medicine to your body. And also they can draw blood directly from this portacath. That avoids them having to stick you constantly in your arms. And because they have recommended 3 months of treatment, which meant that they would be taking blood tests, you know, over and over. They would be administering this, not only the chemotherapy, but other medications like Benadryl and medication that keep your bones from aching and all and so forth and etc. I said, yes, give me the portacath. Okay, so they gave me the portacath, and then after the surgery, of course, I had this little round white thing in my chest, you know, looked like a little hole, like, well, maybe about that big. Wasn't really big. And so after that, I started to go in to have my chemotherapy treatments. The chemotherapist, she recommended 4 different types of chemical drugs. Okay. Now, most people that have breast cancer, and if they opt to have chemotherapy, I think they pretty much have the same types of drugs. One of the drugs I had was called carboplatin. Carboplatin is used to treat various types of cancer. It's a chemotherapy that contains platinum. Yes, platinum. And it's used alone or in combination with other medications to stop cancer cell growth, okay? Cell growth. And I mean, there's so many side effects. I don't really want to get into all of them. You know, if you like, you could look that drug up. It's called carboplatin, and it's CARBOPLATIN. There's a lot of known side effects, you know. Just to tell you a couple, I mean, you get the body aches, the diarrhea, the constipation, and the weakness, nausea, and the vomiting. And you can get all of, some or all or none, you know. I don't think there's too many people that get none, you know. Then there's Taxotere. Oh, I'm sure you've heard of Taxotere. Taxotere, brand name is called Docetaxer. Taxotere is Taxotere. And the brand name Docetaxel is Docetaxel. Now, this medication is used to treat cancer, different types such as breast cancer, lung cancer, prostate, stomach, and heart and neck cancer. Okay, it's a member of the family of drugs called taxanes. This drug is supposed to slow down the cell growth. And there's a lot of known side effects like pain and swelling at the injection site, nausea, vomiting, diarrhea, excessive tearing, fatigue, dizziness, drowsiness, feeling drunk, constipation, a loss of appetite. I had a whole lot of different side effects, I tell you. I had the nausea, I had the diarrhea, I had the weakness, and the pain, and all my hair fell out, and I was completely bald, no eyelashes, no eyebrows, or hair, pubic hairs, hair under my arm, none. Just a hairless creature, okay? They said that would be temporary hair loss, but of course I have on, a wig now, but I literally have no hair. I have a few spots here and there, and it's been close to 2 years. I had my diagnosis July 14, 1949. That I'm telling my age now. July 14, 2015. Okay? And that's when they first discovered that it was positive. I had my surgery August the 10th, 2015, and then a couple weeks later they started the procedure, which ended December 8th, 2015. So, like I say, it's been going on 2 years now, and I still don't have any hair. Okay? So, then they also gave me the drug called Herceptin. Herceptin is also called trastuzumab. I can't even say it, But Herceptin is Herceptin. And this medication is supposed to treat certain types of cancer, including stomach cancer, It's supposed to, what does it do? It's used to treat tumors that produce more than the normal amount of this certain substance called HER2 new protein, or HER2 protein. This medication is called the monoclonal antibody, and it works by attaching itself to the HER2 cancer cells and blocking them from dividing and growing. Okay, this is what this drug is supposed to do. And it may also destroy the cancer cells or signal the body, the immune system, to destroy cancer cells. Okay, their side effects were kind of minimal: diarrhea, muscle and joint back pain, stomach, abdominal pain, or trouble sleeping, nausea, vomiting, mouth sores. I did get some mouth sores. I did have loss of appetite. Of course, they give you pills to help you get an appetite. I'm going to tell you a whole lot more about that, but I want to try to keep the show to 30 to 45 minutes, and because this is a pilot, maybe I'll go 45 minutes. Okay. Now, and then they also gave me the drug called Perjeta. Perjeta, the brand name is Pertuzumab, Pertuzumab. Perjeta is also used to treat breast cancer, and it's for cancer that's spread to other parts of the body. Also, they can use this Perjeta. Now, it's used with other medications to treat the early stages of breast cancer. And because my breast cancer was caught early, they used this Perjeta. And it's also, you know, used in cancer patients that had the surgery to remove the cancer as opposed to a mastectomy, you know. Okay. Now, along with these 4 intravenous drugs, I was also, you know, given medication for the nausea, the vomiting, the diarrhea, the mouth sores, the aches and pains. I was given magnesium and potassium, you know, because my body lost a lot of vitamins and stuff, you know, because you know what chemotherapy is. Well, I don't want to tell you yet, because we're going to get into that in the second show. But I also had what they call tamoxifen. Now, tamoxifen is used to treat breast cancer, also that's spread to other parts of the body. And what it is they give it to you after the surgery and during the after the chemotherapy, but you can take it during radiation. It's just a pill. It's a pill, and it's supposed to reduce the chances of breast cancer in high-risk patients. It's also supposed to block the growth of breast cancer, okay? And it's supposed to work by interfering with the effects of estrogen in the breast tissue. So we're going to talk more about estrogen because I didn't get into that, and I really want you to know about estrogen and why it's important. You know, we need estrogen. All women have estrogen, but when our estrogen gets out of control, things happen, like breast cancer. Okay, so if you feel any lumps, it's first of all, it's important to get a breast exam. So very, very, very important. They say that women 35, I guess, and under don't really have to worry too much about breast cancer, but I would start out getting in a self-examination, and really feel inside your breast, and feel for anything that wasn't there before, or any hard, something that may be a little hard, lump, or feel like a pebble, or anything like that. If you feel any of that type of stuff, make sure that you talk to your doctor, Okay, so I hope that you've learned something about cancer and more importantly, breast cancer. And like I said, in the coming shows, we're going to talk a bit more about the different types of cancer. Well, right now, I want to do a song for you. This is going to take us out. I always want to end all my shows with a song. This is Star. Okay, and today we want to do Back on My Grind for you. Ooh, 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 ooh. I'm going there and never landing nowhere. He wanted me to be distracted with worldly things on my mind. He wanted me to be busy, not giving God any time. But I recognize you. Oh, I see what you're trying to do. That's why I'm getting back on my grind. Getting back on my grind. Getting back on my grind. Yeah. You wanted me to be busy, not giving God any time. You wanted me to be distracted, but I'm back on my grind. Getting back on my grind. Getting back on my grind. Yeah. Getting back on my grind. Getting back on my grind. Getting back on my grind. Well, all right. Okay. And that is going to, end the Ely show today. And I hope that you have enjoyed it. If you have any questions, you can click the link below, or you can just, I'll tell you, my email is E-L-E-E Johnson. That's Ely Johnson, E-L-E-E Johnson at yahoo.com. And so you can, also find me on Facebook, Ethel Lee Johnson. That's my name, Ethel Lee Johnson, in Detroit, Michigan. And if you would like to share your testimony on any of my up-and-coming shows, just email me, and then we'll talk. And I would love to feature you, because this cancer, I tell you, it's a lot to it, and people need to know what it is, how it affects their loved ones, how it's going to affect them, and how hopefully to avoid it. So we're going to talk about some natural treatments coming up in the coming shows. So thank you, and I hope to see you on our next episode.